First of all, what the general public needs to understand is we greatly appreciate what nurses do, right? Who doesn't like a nurse? They provide incredible care, and they do that in concert with physicians and other technical support staff. Healthcare is the consummate team sport. We're all in it together. And nurses are certainly at the front line of the care that we try to provide, the exceptional care we try to provide each and every day.
But for nearly 2 decades, the Massachusetts Nurses Association has been working on a ballot initiative that, if passed, would change nurse-to-patient ratios. Nurses in support of the question gathered outside Cape Cod Hospital on Tuesday afternoon.
For 18 years, I've worked in the medical surgical floor where, like all the other units in the hospital, there is no limit on the number of patients assigned to a nurse at one time. While the best medical research and my own experience shows that medical surgical nurse should never have more than 4 patients at one time, I was nearly always assigned 5.
I've been working on this question for 20 years. 20 years ago, we established that the patients needed some changes, they needed some help. So we have been working on this for 20 years, and now we're going straight to the public.
The proposed legislation would put strict nurse-to-patient limits in place and impose large fines on hospitals who fail to meet the mandated minimum. Cape Cod Healthcare CEO Michael Lauf is concerned about the impact this bill would have if passed.
The real question is, what's the right number of nurses to take care of patients? And unfortunately, the position, this ballot initiative that has been proposed by the MNA, doesn't check any of the boxes that are necessary to say this is what we should do. Unfunded mandates simply don't work. The fact is, governmentally regulating how many nurses should take care of patients isn't appropriate. There's not a single study out there that says quality patient care is a direct result of having more nurses.
The nurses disagree.
I came into nursing to provide high-quality, compassionate care. Every nurse in this hospital wants to provide that level of care. Right now, we can't because this hospital is more concerned with paying its top executives multi-million-dollar salaries with the accumulating huge profits than with investing their resources where it matters the most, in your care and your safety.
Cape Cod Healthcare's CEO says the issue of staffing should be handled locally and that passage would seriously impact the hospital's ability to care for patients.
What we'd like to do is change the conversation. Let's not pass a mandate that was pulled out of the sky by union leaders in Boston. Let's work locally to truly determine with our nurses, with our physicians, with our community, what's the best number of nurses to care for each and every patient. The fact of the matter is, if this ballot initiative passes, if people say yes, it will mean services, it will mean clinical programs, it will mean beds closing on the Cape, right here at Cape Cod Healthcare, because we simply won't have enough nurses to cover it.
But some nurses argue that the hospital's budget is big enough to accommodate more staff.
They can afford this. If they shift the budget, take 3% off the top of their managers and the management and the CEOs make a lot of money. Take a little bit of that. 3% can go into hiring more labor. Hire some nurses full-time.
Take our word for it or take the word from people in Boston. That's not how care should be delivered on the Cape. We know what we're doing. We know what we do as a healthcare team, and we need to focus on that.
Voters decide on November 6th. A yes vote on question 1 would enact those new nurse-to-patient limits. A no vote would make no change to the current system. For Cape Media News, I'm Sarah Colvin.